Hey, I'm Lindsay. I'm your pharmacist. My tech just asked or told me that you had some questions for me. What can I do for you?
Yes, I do have a question today. Actually, my doctor told me that I am at risk of developing heart disease. What is that?
Okay. Heart disease is when the blood flow just kind of slows down, either to it being too thick or because the arteries, which is what holds the blood, becomes really, really thick, and the heart muscle is not able to pump that blood. As a result, some of the tissue dies, and it's not pumping as strong, and someone with this disease could end up having a heart attack.
So what are some signs of heart disease?
One of the most common signs is angina, which is pain in the chest. You can also feel it in your arm, and that happens either suddenly or on a regular basis. So just always keep an eye out for that. And then a stroke could also happen. Do you know what a stroke is?
I've heard of a stroke, but how does someone with a stroke, with heart disease, have a stroke? I thought that happens in your brain.
That does. It's when the heart loses the ability, it's not able to pump that blood up to the brain, and it could also result from a clot. And you might also feel some numb or tingliness. And then you're right, a stroke does happen in the brain, but it's mostly because of the heart. The heart's not able to pump the blood. Like I said, it's the tissue's dying, and so the blood's not able to go up into the brain. The blood, it contains oxygen, so that's oxygen that your brain is not able to have. Also contains sugar, which helps keep your brain going and running that marathon that it has to do. And a clot in the brain causes a traffic jam kind of thing in the artery. So a clot, it's like blood pooling together like pudding. And so you've got this little piece of pudding that's in your brain, and it's stopping everything else, and just like a traffic jam. And I think that's it. What other questions do you have?
So what are some things I can do to prevent heart disease?
That is a really good thing to ask. Some things that help cause heart disease are not eating right, not exercising, being overweight, having high cholesterol, and just all of these coming together, or even just one thing. Even diabetes can come, and it could cause just some bad stuff with that heart.
So what do you think I should do?
I would say, are you a smoker?
No.
Okay, good. That would be number one, is stop smoking if you were. I know it's hard, but you don't have that problem. Also, just eating right, eating your fruits, your vegetables, and starting to exercise a little bit more, eating foods that don't have as much salt in them, and that'll help with the blood as well. Drinking more water and less of your soda pops.
Yeah, that's something I need to work on.
Yeah. What else do you have questions on?
So how will eating right and exercise help my heart?
Those eating right, exercising help your blood pressure and help your cholesterol. And we both know that those are two big things that attribute to heart disease. High blood pressure goes hand in hand with blood flow. It causes your heart to have to work a lot harder to get that blood up there to your brain. And cholesterol causes arteries to be blocked, and so it's like kind of the traffic jam situation again. And by changing your diet, eating less salt, drinking more water, it helps your blood stay thinner, and so it makes it a little bit easier for your heart to pump.
What about fatty foods? I've heard that I shouldn't eat as much fat. Should I cut all that out?
No, some fat's really good for you. Saturated fats are the ones that are bad. They're found in red meat, dairy products, and then your gross food that everyone, your potato chips. Your body uses them to make good cholesterol that keeps your arteries from getting clot, and then your omega-3 fatty acids, which are found in like fish and beans. That's the good stuff. That's what's going to help keep you healthy.
Okay, well, thank you for telling me all this today. I really appreciate it. I'm going to try all I can to keep from getting heart disease.
You're very welcome. You let me know if you have any questions.
All right, thank you.
Good.